Okay, dire-diretso na po tayo ngayon, no, mga kaibigan. I would like to introduce our next speaker. Oh, our second speaker is another distinguished medical doctor, currently serving as the safety surveillance physician, senior executive at Clean Choice. She is also a family physician at Healthweight Philippines and chairs the PAFP Advocacy and Health Literacy Committee. She graduated summa cum laude with a bachelor's degree in psychology from the Far Eastern University, Manila, and completed her medical degree at UARM. Impressively, she ranked second in the PAFP National Diplomate Examination in 2022. Guide us in understanding mental health disorders and how we can address them in the workplace. Please help me welcome Dr. Danica Nicole Gabon.
Okay lang po magtagalog. Okay. Magandang umaga po sa lahat. Maraming salamat po sa introduction at maraming salamat po sa pag-imbita sa akin. Ako po ay first time ko sa GSIS at tuwang-tuwa po ako nung naka-receive ako ng invitation from the department to talk about mental health. So before anything else, I would like to put a trigger warning po, no? Because this presentation contain potentially triggering references. And I would understand if any of you po will be uncomfortable and find it hard to listen, no? But for the purpose of my presentation, our agenda is to discuss the common workplace mental health disorder and how do we support these patients or these coworkers with this diagnosis, and how do we create and maintain a workplace that supports people with these types of mental health disorder. Particularly three po. We have depression, anxiety, and bipolar disorder. Tatlo po yung ating i-discuss. Okay. Forgive me if there will be times po na parang magiging emotional po ako while discussing this topic. Because we all know people die. Some of you might have experienced grief from losing a loved one, from COVID, pwede rin nag-stroke, nagkaroon ng heart attack. In my case, I lost someone to suicide. Two of my best friends were diagnosed with depression. The first screenshot was one of my best friend who underwent treatment. And if you can read, masayang-masaya siya. Because after a year of medication and counseling, he was then tagged as treated from depression. The second screenshot, unfortunately, is the last messages I received from my other best friend before he took his own life by hanging. So you see, nandun pa rin yung guilt, no? Nandun pa rin yung guilt sa akin. Because had I known better, had I thought of things na, ay, baka depression pala to, I would have encouraged my best friend to seek consult. Napilit ko sana siya. Na-encourage ko sana siya. And I want you all to learn from my mistake. I want you to learn ano ang mga sintomas ng mga mental health disorder so that you will not experience the grief and guilt that I am still experiencing now. Or I would like you to think of mental health as parang double-headed arrow. So it's a continuum. At the far left of the screen is you being mentally healthy. At the far right is you having a mental health disorder. Most of the times, nasa gitna tayo. Why? Because life has ups and downs. You may feel good today, tomorrow you may feel low. And that's normal. See, we have challenges. And fortunately, for these types of emotions, they quickly pass away. Diba lumilipas din sila? To give you a context kung gaano ka-prevalent ang mental health disorder globally, 60% of the global population belongs to the working group. So tayo yon, ako, kayo pong mga nandyan, mga nasa Zoom. 60% po tayo ng global population. Of that 60%, 15% was diagnosed with mental health disorder in 2019. So kung bibilangin po natin, to make it simpler, sa bawat 20 employees, 3 po doon pwedeng magkaroon ng mental health disorder. ganun po siya ka-prevalent. We go to the first, the top most prevalent mental health disorder, anxiety disorder. And I want you to look at the screen and see that anxiety is not equivalent to anxiety disorder. Anxiety is a normal reaction to stress. May problema ka sa pera, may problema ka sa pamilya, nagkaroon kayo ng dispute ng iyong coworker, it's normal to feel anxious. When does it become a disorder? Anxiety is not normal if it is so severe that it makes you not able to perform your daily activities. Anxiety becomes a disorder kapag hindi mo na nagagampanan ang dapat mong tungkuling gampanan araw-araw sa sarili mo, sa pamilya mo, at sa komunidad. Why am I feeling this way? This is a very busy slide. But I hope you bear with me kasi iisa-isahin po natin yung mga tanong na ito. Unang tanong, do you feel anxious together with the inability to concentrate, make decisions? Nahihirapan ba kayong makatulog? Nawala na ba kayo ng gana sa mga previously enjoyable activities that you do? Because if yes, then that anxiety may be a sign of depression. Second question, if you feel anxious after giving up an addiction, example, smoking, alak, sleeping pills, you might feel anxious because of withdrawal symptoms. And one of the withdrawal symptoms is nervousness. So anytime you quit something that you have become addicted to, you will start to feel anxious. Third, ang paggamit ng illegal na droga ay maaaring mag-cause ng chemical imbalance sa brain that can also lead to anxiety. Fourth, stressful situations. Nasunugan ba kayo ng bahay? Nawalan ka ba ng trabaho? Nagkasakit ba ang iyong magulang? Kailangan kang maging caregiver? Those stressful situations can make you feel anxious. Panglima, yung anxiety mo ba may kasamang medical symptoms? Ikakwento ko lang po. Merong isang pasyente ako na dumating sa akin, ang reason for consult niya ay laging kumakabog ang kanyang dibdib. Upon further investigation, nakita ko na yung pasyenteng ito has bulging eyes. Sinabi ng asawa niya, "Doktora, naiinis na nga ako dyan, parang lagi akong minumulagaan." Lagi daw nakamulaga sa kanya. Further symptoms showed na palagi siyang nagtatae, madali siyang pawisan, at nangayayat siya considerably for the past year. After I checked the thyroid hormones, true enough, it was hyperthyroidism. So you see, an overactive thyroid gland, a medical problem, can cause anxiety. Pang-anim, in some situations, a degree of anxiety is natural and it usually improves with experience. So kagaya po ng ginagawa ko ngayon, public speaking. Normal po na bago mag-present, may konting kaba and it improves performance in some situations. But if that fear or worry makes you avoid certain situations, hindi ka na pumasok, palagi kang nagtatai pag meron kang something important na presentation to present, I think you should consult a doctor. Ito, do you feel anxious when confronted with certain objects? Kasi baka po ito ay phobia. Or kapag meron kang unnecessary and urge to repeatedly do things, palaging naguhugas ng kamay. Because if you don't do it, nagkakaroon ng anxiety. That might be obsessive-compulsive disorder. Either way, you consult a doctor. And then lastly, panic attacks. You may be having panic attacks na intense feeling of anxiety coupled with physical symptoms. And unfortunately, itong mga panic attacks na ito, they are unpredictable. And most of the time, they don't have any cause. Biglaan lang silang nangyayari. So, ano pong key takeaway dito sa slide na ito? Bakit natin siya inisa-isa? Because I want you to learn that anxiety is not pag-iinarte. I want you to learn, at the end of this lecture, that anxiety can come from so many different things. And the important thing is you consult a doctor. para ma-diagnose at magawan ka ng laboratory to see if it's real psychiatric or if it is a medical condition. Kailan po tayo kailangan magpa-ER when we feel anxious? Sometimes, panic attacks, may mga sintomas po yan na may serious physical symptoms. Kailangan po tayong magpadala sa ospital kapag ang anxiety ay merong chest pain na parang nakadagan, pag po tayo ay pinapawis ng malamig, pag po tayo ay nahihirapang huminga, na yung atin pong labi ay nagkukulay blue, palad ay maputla, wala ng dugo sa daliri. Kasi this may not be anxiety, this could be a heart attack. So the importance of you going to the emergency room ay para ma-ECG at makita na hindi po ito life-threatening condition. Okay? Okay, tandaan po yung tatlo. Chest pain, shortness of breath, at higit po sa lahat, lack of oxygenation. Now we go to depression. Depression is the second top most prevalent mental health disorder. Sana po kailan po pala ang annual physical? Nakapag-annual physical na po kayo. Tapos na. Anong buwan po kayo nag-annual physical? July. Okay. So, yung APE po, sana yung mga doctors po that screen you, mga pinupuntahan natin for APE, meron pong screening. Ako I practice this po. May dalawa po akong tanong palagi sa pasyente ko. Sa loob ng nakaraang 2 linggo, nakaramdam po ba kayo ng pagkalungkot o kawalan ng pag-asa? Pangalawa, nawala na po ba kayo ng interes sa mga bagay na dati po ninyong nai-enjoy? If the patient says yes to one of the two, I have to screen the patient further to see if he fits the criteria for depression or not. Again, ulitin po natin, isa-isahin po natin kasi importante po ito. Why do you feel sad? Are you feeling low after a bereavement? Kasi grief naman talaga over a death of a loved one will make you feel considerably low, right? Meron pa po tayo sa Pilipinas, hindi nga 2 linggo, 40 days ang mourning natin, right? Babang luksa. So, it's normal to feel sad and low for a considerable amount of time. Second, meron bang stressful events? Sa atin po, I hope you learn from this. Meron po tayong tinatawag na reactive depression. Nagtataka tayo sa iba, bakit kaya ang lungkot-lungkot niya, namatayan lang siya ng aso? Bakit kaya ang lungkot-lungkot niya, nag-break sila ng jowa niya, 1 buwan pa lang naman siya? Bakit kaya, gano'n na lang, ang kapayat niya, nawalan lang naman siya ng trabaho? Because we react differently to stress. Hindi po porket resilient ka, you bounce back immediately, is the same for others. Because iba-iba po tayo ng kinalakihan, iba-iba po tayo ng level of education, iba-iba po tayo ng circumstances. Third, it is common to feel a little bit low pagkagaling ka ng sakit. No? After a viral illness, parang down, no? Yung mood hindi ganun kaganda. What more if that illness is a serious disease? Na-stroke ka, hindi ka na nakakapagsalita, bulol ka na, hindi ka na nakakagalaw. Na-heart attack ka, isa kang cyclist, hindi ka na pwedeng magbike. Na-aksidente ka, naputulan ka ng paa. All of these things may not only make it difficult for you to recover physically, but also mentally. Pang-apat, do you regularly drink alcohol more than the recommended limit amount? Sa mga pasyente ko po sa APE, di ba ang tinatanong, umiinom po ba, naninigarilyo po ba? Kasi meron po kaming sinusunod na standard drinks, no, per WHO. Sa akin po, I always ask, why are you drinking? Bakit ka umiinom? Kasi it can be a coping mechanism for a stress. It can also be way for you to mask depressive symptoms. Bakit ka umiinom? Araw-araw ka umiinom, 2 bote, doktora, gusto ko lang makatulog. Bakit ka hindi makatulog? So we have to dig deeper. Again, paggamit ng illegal drugs can cause chemical imbalance in the brain. Are you taking any prescribed drugs? Kasi may mga gamot po that can cause depressive symptoms, believe it or not. Isang example po dyan, contraceptive pills. So if you can see, sa ibang mga kababaihan, no, they feel a little bit low. Kasabay na doon yung malapit ng reglahin, may mga hormonal changes. So, expect. But I want you to know that even if these drugs may cause a little bit low, don't stop them taking right away. Kasi kailangan marinig ng doktor na nagreseta sa'yo yung sintomas for him to advise properly. Kasi baka naman, sa unang 2 linggo lang ito at hindi ka pa sanay sa gamot, hindi ka pa hiyang, ang term po natin, hindi ka pa hiyang. O kaya naman, baka kailangan babaan yung dosage. O kaya naman, palitan entirely. So consult first before stopping any medication. Female specific, may mga hormonal changes. And menopausal or patients who have passed menopause, bukod sa hormonal, nandiyan na po yung fear of illness. Diyan na po lumalabas lahat ng mga sakit. Kasabay pa po nun, sa ibang mga patients, umaalis na yung mga anak nila. Nag-aasawa, bumubukod na, nalulungkot si mother. No? So, why did we isa-isa? No? Bakit natin inisa-isa ito? Because again, I want you to learn that depression is not laziness. Depression is not weakness. Depression is not lack of faith. Depression is a disorder and it is treatable and you have to consult a doctor anytime you think you or someone you know is depressed. Katulad po ng anxiety, kailan po natin kailangan dalhin sa ospital o magpakonsulta ang isang depressed person? Kapag po iniisip na nilang kitilin ang kanilang buhay. Any thoughts of harming themselves even after talking to them. O kaya naman, hindi na po nila naaalagaan yung kanilang sarili. Hindi nila kayang paliguan ang sarili nila. Hindi sila nakakakain without assistance. Or wala po silang support. Ito pong support, it varies. And maganda sa Pilipinas kasi most of us extended family. So, minsan nga kapitbahay pa, no? Nadadama yung kapitbahay. Pakiusap naman, pakibantayan muna si watch mo muna siya for 24/7. Make sure lang natin na hindi siya magpakamatay. If that person does not have that support, meron siyang thoughts of suicide, we have to admit the patient. Kailangan po naka-admit ang pasyente pag naiisip na nilang saktan ang sarili nila. Last is bipolar. Nagsama po siyang depressed and manic. Kaya ang tawag po ng iba dyan, manic-depressive. Extreme mood swings. Di ba po, ang depression, the past 2 weeks, meron kang mga ganitong depressive illness or symptoms. Pero sa loob ng 2 linggo, nag-switch siya. Lagi siyang feeling elated, sobrang saya niya palagi, naging siyang impulsive, feeling niya hindi niya kailangan matulog. Baka ito ay bipolar disorder. The unfortunate thing for bipolar disorder, hindi po sila makapagtrabaho ng maayos. Kasi bukod sa malungkutin sila, sometimes when they switch to their manic episode, hindi po sila nakakatapos ng ginagawa. So they start things that they cannot finish. Hindi po sila nakakapag-concentrate. How do you help? Again, for all the mental health disorders, ang role po natin is to recognize and encourage consult. Sa workplace, ito pong ginagawa natin is also a form of already addressing stigma. Pinag-uusapan. Pag pinag-uusapan po natin, some patients will find it good na they are supported in that environment, making them also share their own experiences. So as a boss, respect work-life harmony, or as a coworker din, kahit hindi ikaw yung managerial sa inyong team. What do I mean by respect work-life harmony? Kahit 5 days in a week kayo magkakasama at karamihan ng oras sa buong linggo kayo ang magkakasama, each of you has their own life. Hindi lang po kayo trabahador. Kayo ay nanay, kayo ay anak, kayo ay kaibigan. Third, increase options. Nowadays, yung mga workers, mas mataas yung satisfaction nila sa trabaho kapag po sila ay able to decide when, where, and how they work. When, meaning flexible time. Where, can be hybrid. How, meaning yung contribution nila dun sa mga projects that they undergo. Fourth, check your insurance policies. Most of the time, mga HMO, ang exclusion nila are psychiatric disorders. But the good thing is, ang PhilHealth, meron silang package, mental health package. In that package, meron kang free 12 sessions, no? For a psychiatric consult. Again, maximize that. Last but not the least, encourage your team members to use their leaves. Nagsisikuhan. May nagsisikuhan. Encourage your team members to use their leaves. Why? Kasi a worker that enjoys his life is more productive. Kapag ang trabahador or ay empleyado ay masaya sa kanyang buhay, he or she contributes more to the company. Self-care. This is very important because the concept is what is good for your body is good for your mind. So, exercise, 30 minutes, 5 times a week. Hindi nyo kailangan po mag-member sa gym para mag-exercise. It can be something you like. Kung mahilig kayo sumayaw, pwede kayo mag-zumba. Kung mahilig po kayo mag-bike, pwede po kayo mag-bike. Hindi nyo po kailangan bumili ng mga mamahaling equipment. Sleep, very important. Ang recommendation po ng sleep, it should be 6 to 8 hours of uninterrupted sleep. So, dapat hindi po siya putol. Karamihan po sa mga patients na hihirapan sila matulog. And then I ask, ano po ang sleep hygiene practices ninyo? Yung kama ba ninyo ay para lang sa pagtulog? Kasi baka doon po kayo kumakain. Baka doon po kayo nagse-cellphone. Baka doon po kayo nanonood ng TV. Kaya hindi nyo siya na-associate sa rest. Yung kama or kwarto ba ninyo, malamig, madilim, makakatulog ka ba agad, wala bang maingay? So it has to be conducive for rest. Yung una, reframing unhelpful thoughts, meron po akong tatlong isi-share sa inyo. This is a cognitive behavioral technique na akin pong ina-advise sa mga patients ko when they have a negative thought. Una, catch it, check it, and change it. So anytime na magkaroon kayo ng negative thought, ang unang pwede nyo pong gawin is to put that thought into trial. Ano pong ibig sabihin ko? Yung trial po, di ba meron siyang attorney na defense, meron siyang prosecutor, at meron pong judge. No, tatlo. Yung negative thought na yon, let's say example, ang thought mo is, I will not do well in the presentation. Yun po yung negative thought. Kung ikaw yung prosecutor, attorney, you will present evidence against that negative thought. Kung ikaw ang defense attorney, you will present evidence for that negative thought. And at the end of that, kung ikaw ang judge, kung sinong mas maraming ebidensya, siya ang panalo. So how do we do that? Negative thought, I will fail the presentation. So anong sabi ni prosecutor? Hindi ka mag-fail kasi nag-prepare ka. Hindi ka nag-fail kasi binasa mo kung anong ipe-present mo. Hindi ka nag-fail kasi pre-practice mo yung presentation mo. See? Ang daming evidences. Anong evidence ni defense? Mag-fail ka kasi wala. Wala siyang evidence. So kung ikaw ang judge ng sarili mong negative thought, panalo yung prosecutor. So change it. Nanalo yung prosecutor. So instead of thinking I will fail, think I will do my best. Second, I want you to think in gray areas. When we have a negative thought, karaniwan po sa atin, ang ginagawa natin laging black and white, tamad, masipag, masama, mabuti, masungit, palakaibigan. Pero you see, ang tao po is not polarized. No? Think of it na you're in a scale. You're a gradient. So, ay 80% lang akong masipag today, 20% akong tamad, and that's okay. Natatawa siya. Ay, natatawa sa gilid. So it's not black and white. Always think of it in grayscale. Third is the double standard method. Anong ibig sabihin po ng double standard method? Tayo po, when we have thoughts na sa sarili natin, yung self-talk natin masyadong harsh. Masyado po tayong harsh sa sarili natin. When in fact, kapag kaibigan mo o malapit sa'yo yung sitwasyon na nandun ka, you will advise appropriately. Oh, let's say, you will fail the presentation. Kung yung kaibigan mo yung nagsabi nun, sabi mo, hindi. Kaya mo yan kasi nag-prepare ka, naghanda ka. That's for a friend. Why not do it for yourself? Why apply a different standard to others compared to yourself? Eh, ikaw nga dapat sa sarili mo mabait ka. Right? Tackling your to-do list. Think of the 3 P's kapag meron po kayong mga bagay na hihirapan kayong gawin. 1 is prime time. Ano yung best na oras na kayo po ay nag-activity? Mas maganda ba kayo magtrabaho sa gabi o mas maganda ba kayo magtrabaho sa umaga? Kasi that can be your prime time. Second, perfect place. Yung place ba na paggagawan mo ng activity should be something quiet? Dapat ba ito ay malamig? Ayaw mo na bang magtrabaho sa bahay kasi pare-parehas lang ang dingding na nakikita mo, walang something new? Then you can go out. Create a perfect place for that activity. And then third is plan a reward. Ito pong pinaka-importante. Kasi tayo po ay parang battery. And think of yourself na yung mag-charge sa'yo ay something you enjoy. So for example, you did an activity. Ngayon, after an activity, prinamis mo sa sarili mo that you will watch a TV show o nagbabasa kayo ng news or something. So make it enjoyable para na-uplift yung mood and you become energized for the next activity. Mindful breathing, no? Ito po ay parang please ko na rin sa inyo. Feet on the floor. Can you put your feet on the floor? Okay. Find a comfortable spot. Sandal po ninyo yung inyong mga likod sa upuan. And I want you to close your eyes. Okay. I want you to close your eyes. And ngayon, please breathe in and breathe out. Okay. Now breathe naturally. Notice nyo po yung sensation ng breath entering and leaving the body as best as you can. I-relax nyo po yung being aware of it. Focus on how your body feels. Do you feel your feet on the floor? Do you feel the tips of your finger? Do you feel the sensation of your clothes on your skin? I want you to take this time to pay close attention to all the physical sensations from the top of your head, down to your shoulder, down to your abdomen, down to your waist, and then down to your toes. Just take the time to notice your thoughts and feelings without judgment. One more deep breath in, and then breathe out. Now open your eyes. How do you feel? Nakaantok. Why? Because you felt relaxed. So, in any situation that you feel stressed or anxious, you can do that mindful breathing. So that will be the end of my slide. No? If you have any question, you can give me through email. But I think we have a Q&A session as well.
Yes.
And these are my references. Thank you so much.
Yan, maraming po salamat, Dr. Gabor. Bali mo yung tinulong nyo kanina, is that basic meditation? No?
Yes, it's part, no? Also includes yoga and the like.
Ayan, very good. Okay, thank you very much for a very informative topic. Parang nalulungan ho kami talaga. In layman's terms, actually, ang nangyari. Okay, naintindihan ho namin ang gusto. Are there any questions from the crowd here?